Good afternoon. Good afternoon. I'd like to welcome you to today's Medical Center Hour. I'm Marcia Day Childress from the Center for Health, Humanities, and Ethics here in the School of Medicine, and we're pleased to welcome all of you here this afternoon for what will be, I think, a wonderful program and a marvelous exercise in being mindful about who we are and what we do. What does it mean to practice mindfully, and why does this matter? While intended for clinicians in healthcare, this Medical Center Hour today with physician author Ronald Epstein has potential applications for any professional who seeks to be a reflective practitioner. Mindful practice refers to a quality of mind that includes self-awareness, self-monitoring, and self-regulation, and that leads to greater attentiveness, curiosity, flexibility, and presence. Mindful clinicians provide higher quality care, make fewer errors, form stronger bonds with patients, listen more effectively, and are less subject to cognitive bias in decision-making and implicit racial and gender bias. Additionally, mindful practitioners are more likely to respond to stress with creativity and resilience, and they tend to experience a greater sense of meaning and connection in their work. This program, titled Attending Medicine, Mindfulness, and Humanity, marks the return to Charlottesville after many years of Dr. Ron Epstein. Dr. Epstein is professor of family medicine, psychiatry, oncology, and medicine at the University of Rochester Schools of Medicine and Dentistry. He is also the American Cancer Society Clinical Research Professor and co-director of the Center for Communication and Disparities Research at the University of Rochester. You'll find a short bio sketch about him in your handout. Long a vigorous investigator and proponent of mindfulness in medicine, he's collected his expertise on mindfulness and its applications into this remarkably lucid and eminently useful book, Attending Medicine, Mindfulness, and Humanity. He published this book in 2017, and I'm delighted to say that UVA Bookstore is here outside our upstairs entrance with copies of the book available to you, and Dr. Epstein will be able to stay for a very few minutes before a flight home to sign your books. We're delighted that Dr. Epstein is here as our 2019 Moore Lecturer in the School of Medicine. This is an annual lecture that celebrates a physician-writer whose work in both doctoring and writing makes a difference. His presentation will propose ways we can become more mindful at work, even in today's fast-paced, busy workplaces, and how we can foster institutional cultures in education as well as in clinical care that promote and actually practice mindfulness. We are delighted also to welcome Dr. Ina Stevens, on my far right, Associate Professor of Pediatrics here at UVA. She's actually fresh from a 3-day workshop with Dr. Epstein and colleagues in Rochester, and she will offer a brief response to Dr. Epstein's Moore lecture. I'll mention that neither speaker had any conflicts of interest to declare. I'd like to quickly thank our co-presenters for today's program, UVA's Contemplative Sciences Center, the School of Nursing's Compassionate Care Initiative, and the Center for Interprofessional Collaborations, and also the Department of Medicine, for which this program is a medicine grand rounds. Dr. Epstein, welcome.
It's a pleasure to be back here in Charlottesville. It's just such a beautiful place. I was walking around the campus yesterday afternoon, and it's just really lovely. And I was meeting with some of the leaders in ethics and humanities and mindfulness and this morning, and I'm just in awe of the work that you all are doing. This is really a center of excellence in terms of the kinds of things that I'll touch on here. I also want to thank you personally, Marcia, just for inviting me. It's really an honor, and I'm really glad to be with you. So I'd like to start with an exercise in imagination. Let's say that you went to bed tonight and you woke up tomorrow and you had a good day at work. Okay, imagine that. Okay, but by a good day, I mean that you were flourishing, that you were doing the work that you feel that you were meant to do, that gives you a sense of purpose and meaning. It's not that it's an easy day, but it's a day that when you feel like you're kind of at the top of your game and able to provide the kind of care or service that, that you feel proud of. And just for a moment, think about what you would notice about yourself if you were having such a day. Okay, what would you feel on your inside? Okay. And then what would other people notice about you? Okay, so those two questions. What would you notice about yourself? And what would other people notice about you? And for this next part, I will need your cooperation. In about 5 words or less, say something that you would notice about yourself. And in 5 words or less, say something that you would note that other people would notice about you. And turn to a neighbor and just say those things. Okay? Okay. If this were a workshop, I would kind of leave you for longer than a minute, but hold on to those things, okay? Hold on to this knowledge of your interior and also what other people can notice about you when you're flourishing. Rollo May, who was a psychologist who wrote actively in the 60s and 70s, talked a lot about human freedom, but you could substitute in the word flourishing at work or whatever you like there. But it involves our capacity to pause between a stimulus and a response. Okay, so all day we have these stimuli. Okay, we see patients, there are difficult situations, there are things, conundrums that we haven't addressed before. And this act of mindfulness is first of all finding a pause, okay, and then at that point, choosing the response towards which we want to throw our weight. This sounds really simple, but in the chaos of the work that we do, we often don't seek out and find those pauses. About 20 years ago, I wrote an article for JAMA that was born out of a need to address what I thought was important about medicine. I was in the process of trying to define what competence was of doctors. And clearly there's, the technical skill part and the knowledge part, but you don't choose a doctor for yourself on the basis of their board scores, right? You choose them on the basis of things that are a little bit harder to describe. So I took it upon myself to try to describe the interior landscape, those things, those qualities of mind that distinguish doctors who might be good from those that I would really choose for myself or choose for family members. And came up with this idea of mindful practice. This didn't come out of thin air. I had spent a long time studying Zen Buddhism when I was younger, a long time studying music, and it was the qualities of mind that I felt that I was able to achieve as a meditation practitioner and as a performing musician, which were quite similar, and were actually quite similar to the state of mind that I felt that I was in when I was practicing at my best as a physician. So it has to do, and mindfulness is purposeful. It's not something that just happens to you. It's something that you intend to do. So you can think about mindfulness as a vector. It's not a state. It's a movement towards. It's dynamic. And it has to do with one's physical and mental processes, and it also is a vector pointing towards something. And in this case, I said clarity and compassion, but you can fill in other adjectives there. Now, when we think about mindfulness, this is a picture of the Milford Sound in New Zealand, an utterly spectacular place. When we think about mindfulness, we see images in the media about mindfulness. It usually involves someone who, is sitting by a scene like this. And maybe there are some lotus flowers, maybe there's something else that's really appealing. And this is absolutely beautiful. And I've been in places, I've gone to retreats in places like this. It's absolutely wonderful. But this is the mindfulness that really matters. So how many of you have ever been in a code? Okay. Now, can you imagine what a mindful code might be? Okay? Imagine everyone working at the top of their game, communicating effectively, saying the things that need to be said, not saying the things that don't need to be said, and working in the same way that a string quartet will be working together to produce something of beauty. Okay? So this is the mindfulness that matters. About 800 years ago, the Incas built this wall in Peru. This wall is still standing. The walls built by the Spaniards 200 or 300 years later crumbled and were rebuilt several times. So what's the difference? The rocks here, they look like the lines between the rocks are relatively straight, but if you take the rocks out, they're actually concave and convex on the bottom. And Peru gets a lot of earthquakes. And what happens during the earthquakes is the rocks just slowly move with respect to one another and then settle back in, okay? So mindfulness is this capacity to have a kind of mental stability without mental rigidity. When you build a building with mortar and bricks, that's rigid. When you build a building without and these walls that have that suppleness, I mean, it's hard to think of a rock as being supple. That's more the mindfulness we're talking about. So there's been about 20 years of research correlating mindfulness with the interior lives of physicians, so reduced stress, burnout, positive emotion, greater sense of community, with psychological factors like attentiveness and comfort with uncertainty and implicit bias and cognitive flexibility, with outcomes, things like safety, accurate diagnosis, empathy, patient-centered orientation, and patients do notice. So there are studies that survey patients of clinicians who are rated higher in mindfulness and lower in mindfulness. And so this is the simple hypothesis that I have, that by practicing mindfully, you can experience a greater sense of well-being, and also in doing so, have a greater quality of technical care, and also a greater quality of relationships with patients and colleagues. So mindfulness, as I mentioned before, is purposeful. It starts with intention. So intention is from the past to the present. So thinking about right now, you can think that everything that's ever happened to you in your life has led to your being here, right in this room right now. I mean, you could be out for a walk, you could be eating lunch with a friend. You made a choice, a conscious choice to be here. And then it's also looking into the future about, well, what would flourishing really look like? You know, where do you want to go? Where are you heading? So that's intention. The second part has to do with attention, and I believe that attention is an ethical act. It's where you place your attention that really matters. So I had a patient who is 90 years old. I've taken care of her for about 25 or 30 years. She's an avid folk dancer, used to run folk dancing trips to Romania and still dances, although her balance now is not all that great. My wife played a concert and there was a reception afterwards, and she was at the reception. And she turned to greet me, and in doing so, lost her balance and fell to the floor and hit her head. Okay, so I saw this big bump. I was worried, called the EMT. She went to the emergency room. Everything happened like clockwork there. She had her CT scan, everything was okay. But when I called her later that evening, she said that no one actually offered her a bag of ice for her head. And she had to ask for it several times. No one ever brought it, and she put it on an ice bag at home. Okay, this seems like a really minor event, right? Okay, it's not included in your quality metrics. But in fact, this is due to where we parse our attention. We're placing our attention on the CAT scan. CAT scan is really important. You want to make sure she doesn't have a bleed. But also the personal experience of suffering. And of course, we can think of more dramatic examples of this. I remember as a medical student, we had a patient with hairy cell leukemia. And back in the dark ages when I was a medical student, that was one of the few conditions that was understood on a genetic basis. And everyone was fascinated to see this woman. And I went in on rounds, and I saw this woman who was alone. There was no sign that anyone had sent her a card or a flower or anything. And she was in pain, and in fact, her pain was inadequately treated. So this person who was intellectually fascinating, who captured the attention, the intellectual attention of her care team, they failed to see her suffering. And we see this all the time in medicine. So there's intention, there's attention. The next piece is curiosity. And I think I've been in primary care practice for 35 years. I just stopped my practice very recently, but and had some of the same patients for 35 years who had some of the same complaints for 35 years. Okay, so how do you like survive this? Okay, and yes, sometimes the person with the chronic abdominal pain that never gets better, one day it's different, and you do a test and find out that there's something else going on. That's a surprise. Okay, this has happened. Okay, but so. Faith Fitzgerald, an internist at UC Davis, wrote an article about 20 years ago on curiosity in medicine, and there are some great stories in there. And she also, she's a great fan of finding curiosity, beauty, and art in the very clinical acts that we engage in. So going to an art gallery and reading literature is great, but really where humanism comes to its fruition in medicine is when you're there face to face with a patient. So she tells a story about a patient being presented on rounds, and the resident mentioned a scar in the patient's groin. She asked the resident how the patient had acquired, the scar, and she said, sorry, it should be he had acquired the scar. She said, he told me that a snake bit him there. How did that happen? I asked. I don't know, she said. How many of you have had a patient who's been bitten in the groin by a snake? I mean, the imagination runs riot. I mean, how this could possibly have happened. How could you not ask, okay? So there's intention, attention, curiosity. In Zen Buddhism, there's a concept of beginner's mind. It's not that you need to be a beginner. This is actually for experts. So I take care of a lot of patients with diabetes, and I know a fair bit about diabetes, but I may not know a real lot about this particular person. And so this patient I find frustrating because I see on his refill list that he's not refilling his medications and his blood sugar is sky high. And so immediately in my mind flashes this word non-compliant. This is like worse than the 7 levels of hell, but then I ask him, curiosity, well, why do you suppose this is? And basically the story emerges that he's trying as hard as he can. He doesn't have a lot of money. He's in the donut hole for his Medicare drug reimbursement, and they have to make choices about food versus medicines. And then suddenly this person who I'm ready to label as lacking in virtue is suddenly seen as someone who's self-sacrificing. So is he non-compliant? Well, yes, I guess he is. And is he virtuous? Yes. We can actually hold these contradictions at the same time. So a Zen story. 2 monks were looking at a flag fluttering in the wind. One said to the other, the flag is moving. This is a Zen story, so 3 hours elapse. The other replies, the wind is moving. Wei Neng, their teacher, heard this, and he said, neither the flag nor the wind, mind is moving. So part of being mindful is being able to see this situation from 2 perspectives. So take a look at this photograph. This was taken during Superstorm Sandy. Most people looking at this would not feel a sense of calm or tranquility. And if you wanted to go out for an evening stroll, you probably wouldn't choose this pier to walk on during the storm, right? Or maybe, depends on your sense of adventure. Same beach, same storm. Let's presume that this young surfer is neither suicidal nor psychotic. And so when you show up for work Monday morning, does it look like this? Or does it look like that? He might get banged up a little bit. He'll probably get a little stronger in the process, might get a little better at what he does. And it's not that either of these, imagine you're a photographer standing on the beach. You can take a picture this way, or you can take a picture this way. Which one are you going to sell to the New York Times? I mean, it's, they're both true, right? So holding on to these contradictions. And William James once said that the capacity to hold two contradictory ideas at the same time and still maintain the ability to function is a sign of a well-developed mind. So So this is a painting that Goya made of his doctor. Goya had a very serious illness. And there's an inscription under the body. He recovered enough to paint the painting. But in the inscription below, he says that this painting is dedicated to my friend, Dr. Arrieta. Now, there's a long tradition of virtue ethics in Spain, and Pedro Laín Antralgo, a philosopher and pathologist there, talked about the ideal doctor-patient relationship being one of what he called a medical friendship, that it extends more than just simply doing your job and involves qualities like caring, and he even used the word love. This is a very intimate painting, and Dr. Arrieta is supplying some medicine, but he's also literally physically supporting the patient. So this quality of presence, which is hard to describe but easy to depict, I think is fundamental. As a musician, I know what it's like to be present, and I know what it's like to hear performances when people are present and when they're not. And when people aren't really there, musicians say they're kind of phoning it in. And you know that, right? And you know that from your doctor. You know when your doctor is kind of like not really listening or kind of half there. And it doesn't really feel good if you're that doctor who's half there. You kind of feel like, I've had a very successful life, wish I was there. So a personal experience, I was in the emergency room a couple of years ago, and for abdominal pain that was a little tricky to diagnose. And again, the doctors and the nurses all were very caring. But the one thing that stuck out for me was the guy who transported me from the emergency room to the CAT scanner. And as we were about to round the corner, first of all, he told me where all the bumps were and when we were going to turn, because it's really this disorienting feeling when you're lying flat on your back looking up at the ceiling. But then he kind of looked me in the eye and said, how are you doing? Okay, and it was just that quality of gaze, This took zero effort, okay? It didn't lengthen his day, didn't add to his stress level. It was not cognitively demanding. But he noticed that I was scared. And so those little acts, and the accumulation of those little acts, I believe, connote presence. So if all of these things are good, or if attentiveness, curiosity, beginner's mind, presence, intention, all of these things are good, why don't we do them all the time? Many of you may have seen this drawing. This was in JAMA in 2012. Betsy Toll published it along with an article called The Cost of Technology. And so you can see the patient. She's a pediatrician. This was actually drawn by a patient of a resident of hers. So you can see the patient happily sitting on the exam table and mom reading an outdated magazine and siblings behind. I mean, children are optimistic, so everybody's smiling in the picture, but look where the doctor is, okay? And so sometimes institutional factors keep us from being present, and we're often not even quite aware of that, right? So just this, she depicts the doctor as smiling, but if it were me, I wouldn't really be smiling, I would feel kind of disconnected. So this is a painting of Prometheus. I'm not a Greek mythology expert, but I know that Prometheus brought fire to humanity, much to the dismay of his boss, who happened to be Zeus. And Zeus had him, in retaliation, chained to a rock, and every day an eagle would come and peck at his liver. Okay, so I often ask, groups of doctors, like, what pecks at your liver every day? What is it that's kind of, So there are some things that are inevitable in medicine, like emotional intensity and unpredictability, but there are a lot of things that aren't. I mean, multitasking interruptions, productivity issues, dysfunctional computer systems, which are often driven by these meaningless administrative requirements that we have exclusively in this country, actually, and exist to a much lesser degree elsewhere. Our chart notes are between 5 and 8 times as long as any other country in the world, and mostly filled with, as you know, not very helpful information. So, but I think the bottom two are the most important, a sense of lack of control coupled with high responsibility, and that's a formula for learned helplessness. And the other one is isolation. I think we all you had more face-to-face encounters, had a greater sense of intimacy amongst us, which doesn't exist quite as much anymore. Empathy is a good thing. Michael Carney described it as exquisite, leading to a sense of shared mind, communion, being with, heartfelt, highly present. But it also has a dark side. These were both self-portraits, the first by Van Gogh and this one by Frida Kahlo. I mean, empathy can be really disturbing. Imagine, I've got a patient who's 40, has been diabetic, type 2 diabetes since age 12, has been on dialysis for 10 years, and in the past 2 years, he's had 6 amputations. Okay, so foot, leg, other leg, and 3 fingers. And has a non-healing sacral decubitus ulcer, and becomes hypotensive and develops muscle cramps whenever he gets dialysis. The hardest part for me is that he's eternally optimistic that this is going to get better. And so this cognitive dissonance. So saying that empathy is putting yourself in someone else's shoes, I can't really, and it's also painful. It's difficult. You know, we tend to turn away. You know, when I first saw this painting, you know, I looked at it and then I had to turn away, and so mindfulness is turning towards, but sometimes it's not easy. Okay, and I mentioned implicit biases, a nice paper by Diana Burgess and Mary Catherine Beach and Sam Taha, that has really correlated mindfulness with reduced implicit bias, those biases that we exhibit but often aren't particularly aware of, based on disability, based on race, based on ethnicity, based on gender, based on age, what have you. There's a reduced activation of stereotypes. So there's been a lot of talk about burnout, but I like to see it in a larger context of work-related distress. And I see that as a problem of a relationship between that vision you have, that you articulated to one another as we began, of what it's like to flourish on the one hand, and on the other hand, looking at what you do every day. Okay, so for me, I mentioned this in a small group this morning. When we got our new electronic medical record that was supposed to bring much happiness, after a few months, a patient said to me, I'd had this patient for like 20 years or so in my practice, and he said, you know, can I tell you something? And I said, well, yeah. He said, you know, you used to be a good listener until you got this computer thing. And that was like kind of a knife through my heart, because I teach communication skills and I teach mindfulness, and this is like a betrayal of everything that I value. So that's what I mean by work-related distress. It's a moral. Christina Maslach, who created the Burnout surveys that many of you probably have done, originally defined burnout in existential terms as an erosion of the soul. Okay. So there's no pill I know of to cure an erosion of the soul, right? And a deterioration of values, dignity, spirit. But I think we've all experienced this to some degree. But we know that it matters in terms of pragmatics, in terms of quality of care, patient's experience, clinician's experience, safety, professionalism, civility. And it's also, and when I talk to leadership in healthcare organizations, although this is not the reason to be mindful, I think it does have consequences in terms of costs of care. more burned out physicians retire earlier, they take more time off from work, they're sick more. It costs the system, on average, several $1 million per year. And there's a lot of research that seems to support this. So what's the opposite? Well, Christina Maslach said work engagement, but that wouldn't get me out of bed in the morning. Resilience, I think that's important, but whose resilience? I see resilience as a collective phenomenon, not just individual responsibility. Well-being, I often talk to the general public about these issues, and when I talk about physician well-being, it conjures up images of golf courses and beach vacations. And so, I mean, all these things are good, but for me, the word is flourishing. And for you, it might be thriving or being robust or whatever. But, just think about not what you want to get away from, but also what you're heading towards. Although I'm focusing on the inner life, I want to make sure that to emphasize that a lot of the responsibility for dealing with physician distress and promoting physician mindfulness and also mindfulness in other health professionals is an organizational responsibility. So if you're going to have a stress management program, I mean, on whose time do you do that, right? Does it, who? And these, I think, are moral choices about what you value and how you pay for those things that you consider to be important. I've been in a lot of institutions that now have wellness officers, chief wellness officers, who have very, very nice offices and no budget. And from my perspective, that's bankrupt. And from the institution's perspective, there are things they can do that are not expensive that actually can make a fairly significant difference. So this is just my short list about qualities of leadership. Some institutions consider clinician well-being to be a quality indicator, just like 30-day mortality. Administrative and regulatory burden, thinking about teams, thinking about medicine as a human enterprise, forming people, not products. Skills training, coaching, and so these are all programs, some of which we have in our institution and some of which I've seen elsewhere. Cognitive ergonomics refers to designing information technology to fit the way the human brain works as opposed to vice versa. So Amazon does a really good job of that. They know exactly what I want to buy next. But Epic does not have a very good idea of what this patient needs right now. And so just a poem, because this captures a lot of what I try to teach. There are two kinds of intelligence. This was written by Rumi in the 13th century. Two kinds of intelligence, one acquired as a child in school, memorizes facts and concepts from books and from what the teacher says, collecting information from the traditional sciences as well as from the new sciences. He wrote this in the 13th century, so there were new sciences then too. And with such intelligence you rise in the world, you get ranked ahead or behind others in regard to your competence in retaining information. You stroll with this intelligence and in and out of fields of knowledge, getting always more marks on your preserving tablets, your boards, your CV, et cetera. So, but there's another kind of tablet, one already completed and preserved inside you. A spring overflowing, a spring box of freshness in the center of the chest. This other intelligence doesn't turn yellow or stagnate. It's fluid and it doesn't move from outside to inside through the conduits of plumbing learning. The second knowing is a fountainhead from within you moving out. And I see our job in medicine, in educating, is to acquaint our learners with this fountainhead. We can't make it happen. We can't give them mindfulness. So on the left-hand side of this, you can see all the positive values, the things that you'd be looking for in an applicant for medical school or residency. But each of those has a dark side, okay? So when we're looking inside ourselves, we do want to pursue excellence, but as soon as it begins to cross over into perfectionism or invincibility, or when we feel like an imposter, or if we feel omnipotent, if we have an excessive need for certainty rather than having a comfort with uncertainty. So thinking about where on the balance, that these virtues are all good things, but it's the expression of the virtues that sometimes get us into trouble. So it's not like we're trying to do bad things to ourselves or other people. In fact, we're all trying to do the right thing, but somehow got lost along the way. So the first step is becoming aware of your mental state. So again, just another little mental exercise. Just imagine that your stress level was just beginning to get higher, just a little bit higher. What would you know? What's the first thing that you'd notice in your body? Okay, is it that your stomach gets tight, your shoulders get tight, you grit your teeth, your breathing gets shallow, you feel sweaty? You know, what emotions, what thoughts? We don't have time to discuss this much, but we tend to push away those negative sensations. None of those things are very pleasant, right? And our first inclination is to push them away. And so the radical thought is turn towards them, okay? Use that as a meter, as your own little personal distress meter, because we're all resilient and we're all good at dealing with small stresses if only we could identify them, okay? So the first thing has to do with awareness. The second is understanding that mindfulness is a capacity that can be grown. I know as a performing musician, I started out like this. You know, if I got too relaxed or too bored or too anxious, too excited, I couldn't really perform well. It's not that the anxiety goes away. You know, the top musicians in the world get terrible stage fright. It's just that they're able to channel that energy and also recognize that so that they can use it towards producing something that's beautiful and exquisite. A lot of well-being programs talk about things that you do outside of work. You know, take a vacation, spend more time with your family, eat well. I mean, all this stuff is really good, okay? But let's say you take a wonderful vacation for a week and then you come back to work, and guess what? Work is exactly the same as you left it, okay? So well-being, in my view, is changing this relationship, you know, in some way, either your own internal relationship to your work or doing something about the work environment that and all of you, in some sense or another, are in a leadership role. Even if you're a third-year medical student, your second-year colleagues are looking up to you. There always is something that you can do about the environment. And then finally, mindfulness is a community activity in the sense that none of us can do this alone. That now you have at least an idea about what one other person in this room experiences when they're flourishing, okay? And just that knowledge that you have that shared knowledge of one another. And imagine if you had a conversation amongst all of you, and let's say you had more meetings like this in the medical center, people would begin to understand what makes individuals flourish, what they look like when they're flourishing, and what they look like when they're not, okay? So that's what I mean by collective mindfulness. In the workshops that we do, we train doctors to meditate, but start small. Saying, well, can you figure out a way to spend 2 minutes during a day when you are quiet, when you can just take stock of your interior life? And maybe if you're a surgeon, it's while you're washing your hands, or maybe, you know, there's a natural point in the day where you can, rather than pulling out your phone, you can just simply check in with your inner operating system as opposed to the outer operating system, okay? We have doorknobs and door handles, and these are your friends, because every time you touch a doorknob, it gives you the opportunity to stop for a moment, to take a breath, to set aside mentally what's just happened with the previous person or encounter, and then adopt an attitude of freshness, attentiveness, and presence and curiosity when you go in to see the next patient. And imagine you're in full-time practice and seeing 100 patients a week, and let's say it's 40 weeks a year. You get to repeat this 4,000 times a year. Anything you do 4,000 times, you begin to get kind of good at. And let's say you do it 10 years, that's 40,000 times, and I've done this for about 30. So you can multiply, okay? So it becomes habit, and it becomes the new normal. Reflective questions. These are the questions I ask on rounds. So like if there's something you ignored, what might it be? You know, I can't answer this question for a resident or a student, okay? But it gets them to explore their own inner landscape. Well, can you see the same situation with new eyes? Good. What are you assuming that might not be true? What surprised you? Okay, all of these, and I ask myself those questions as well. So again, this is mindfulness in the moment. But most of our work actually is not alone by ourselves on a cushion at a retreat center. Most of our work is with other people. And I like this quote from Stephen Covey: most people don't listen with the intent to understand, they listen with the intent to reply. And so I'd invite you to engage in more deep listening. That is, when you're talking with someone, to spend more of your time listening. Doctors generally talk 60 to 70% of the time in office visits. Try reversing that, see what happens. Be curious, ask questions that aim to deepen understanding, and wait a little while before you make interpretations, give advice, and especially talk about yourself. Okay? So we do exercises involving writing narratives about a time that was particularly meaningful or distressing, or when there was an error, when a patient died, when you felt attracted to a patient, when you felt you were working with a patient you couldn't stand, when there was a conflict. So the themes are numerous. But rather than just simply trying to take the narrative at face value, trying to understand how it manifests itself in your body and your mind. Other approaches include doing appreciative inquiry interviews, focusing on strengths, so trying to find a difficult situation in which you were at your best, and identifying the strengths that helped you get through that situation. And there are a variety of other approaches in dialogue to foster individual understanding as well as this idea of shared mind, of being on the same wavelength with another human being. I believe that those ingredients of understanding, that noticing, that capacity for well-boundaried emotional resonance, plus a wish to alleviate suffering, is fundamental. We talk a lot about compassion, but I think it's something that actually needs to be practiced, okay? So this noticing piece, what do you tend to ignore? What don't you notice? If a patient presents a physical symptom and a psychological symptom, which one are you going to ask about first? And is that a moral choice? Well, it might be if you ignore 80% of one and attend to 80% of the other, right? So, and I also think that that this begins with a certain humility towards oneself, that being able to turn towards those difficulties within oneself, but also with a sense of common humanity and kindness towards oneself as well as towards others. So we tested out some of these ideas. This is published about 10 years ago with a cohort of 70 primary care physicians to see if these approaches, meditation, various other kinds of self-awareness exercises, narrative, appreciative inquiry, could produce a change in their patient-centered attitudes, their well-being. And we actually measured personality to see if certain personalities would actually resonate more with the program or not, or get more out of the program. We weren't surprised to find a reduction in burnout and an increase in mood because, generally speaking, mindfulness programs do that. But we were surprised to find a dramatic increase in patient-centeredness and empathy, and also found that the respondents' personalities changed. They experienced greater emotional stability and a greater sense of focus. And then in interviews we did a year later after the program, we found that physicians felt a greater sense of community. That the stories that they told one another were particularly important, and that it was possible to foster introspection that actually would continue after the program ended. This is a before and after quote. She's saying that she's a pretty good listener. She would spend extra time, but that it was sucking her dry. She would be so empathic and then would feel frustrated. And so she's really describing what got her burned out, that contributed to her emotional exhaustion. I would start to feel the way they felt. I mean, take 4 of these in a row in a day and I would be just wiped out. So the after part is that it's not that I don't empathize with them anymore, but I feel okay just to listen and be present. And in some ways that helps them more. It's a wonderful thing you can do for patients. Just needed to learn that. Feeling more honest, thinking more clearly, speaking more honestly, that definitely leaks out into your work every day. It opens you up to being more ready with patients, colleagues, and family. Intimacy. And then finally, someone who came to the program initially for stress reduction, and then as time went on, she was learning to communicate with herself as much as anybody else. I sort of gave myself permission to start thinking. So I'd like you to, in closing, think about one thing that you could do to help you be more present, more attentive, more mindful, more compassionate, more grateful. Choose something small that's clearly within your reach, and consider how you'll remind yourself. Maybe even tell a colleague what's this one thing. So maybe it's like have lunch once a month without looking at a device. Okay? Okay. Something really small. Okay. And I'm a great believer in habit. I think that what you do habitually becomes what you are. So picking one thing to do or two things that you can do repeatedly over and over time, that will help begin to be the seed to bring you closer to those aspirations to help you flourish more effectively in whatever you do in healthcare. So I know we have a few minutes for reactions and then questions, and I just again want to thank you for inviting me.
Okay, can you all hear me? I'm only going to take just a few minutes because I don't think I have really too much to add to Dr. Epstein's talk. I really think he has said it all. But what I want to just say for a moment is how incredibly grateful I am, number one, to be up here and to be able to talk to you just for 2 minutes, but I am so incredibly grateful that I got to spend 3 days in your workshop just this past week. And if I could promote it for a moment, everybody should go. Anybody in healthcare, you don't need to be a physician, nurse, PA, it doesn't matter. If you are interacting with anybody, even like your kids or your neighbor, you should go because it just is incredible. And I will tell you that I have been meditating and I have been practicing mindfulness practices for over 25 years. And what I'm so grateful for is that I know that I can always learn something, and I learned so much, and I'm really grateful. Thank you. People ask me a lot, because I run a mindfulness, medical yoga, integrative health clinic. What does this mean? What is mindfulness practice? What does meditation mean? And what are you doing? And what I say to them is that, it's really about paying attention. It's about actually just really paying attention. And as Dr. Epstein said, it's about really listening. It's about deeply listening and listening to yourself while you're talking to that patient. And I say to the residents, are you really paying attention and talking to that patient? Or are you kind of all over the place when you're talking to that patient? Have you really even heard what that patient said? And, they think that this mindfulness or meditation stuff is kind of maybe some new age phenomenon. It's getting all blissed out. Actually, that's not really what it's all about. It's really about really paying attention. And that deep listening and paying attention is a true gift that you could not only give to your patients by listening to them, but it's a true gift to yourself. And you should kind of take that away with you and just be like, you're giving yourself something every day. And that, in all honesty, is what kind of gets me through my day quite a bit. And I think that this is a really, really important part of medical training. I wish, and I think everybody in this audience sort of knows this inherently and sort of desires this, but may or may not have had this in their medical training. And unfortunately, it's not in medical training. I think it's a really important part to be able to teach this to the medical students and residents, and that's why it's a real passion of mine to really be able to teach this to the young physicians, because they're not taught this, and it took me quite a long time, and I probably think it's taken you all a long time. And obviously, life is a journey, but We got to at least give them those little seeds. We got to start planting those seeds in medical school. So I just want to end, I really only have one more minute, but I want to end with a little bit of a book promotion here. So I'm actually going to read a quote from Dr. Epstein's book that really kind of hit it home for me, and I think kind of sums a lot of this up. And so this is from The Attending, and it says, "The attending's responsibility is to direct the clinical team's attention to the most important things. Take charge, make the patient feel attended to, and provide attentive care." Attending actually means showing up, being present, listening, and accompanying the patients when it matters the most. Attending is also a moral imperative. By being attentive, doctors not only provide the best care, but they're actually honoring each patient's humanity. And that was a direct quote. There's a lot of more good information in that book, so I would recommend everybody reading it. Thank you.
Thank you both for wonderful presentations and a lot to think about. We have about 10 minutes for your contributions as our audience. Many of you are practitioners at different levels of learning, and we're eager to hear from you, your comments, but also your questions, which you may direct to Dr. Epstein or to Dr. Stevens, or both. And I'll ask that when you do ask a question, please identify yourself. We have a couple of microphones that we will bring to people, so this comes on the recording as well. So who would like to start? Bring you the mic.
Jody Esselstyn, nurse practitioner. I'm curious what you see happening in medical education these days that you think is promoting this kind of mindful practice for medical students so that it's not getting into practice and edging into burnout before they start to seek this kind of thing out. What are some of the successful mindfulness teachings that you see happening?
Well, make sure you turn on your tabletop microphone.
Thanks. Okay. So there's now a real focus nationally on professional identity formation in medical schools. And some places are really actually taking this seriously. And I think I like the way that that's framed as opposed to professionalism, which has both a bright side and a dark side to it, kind of a guild side to it. But and I know and that's taking different forms, but so that does give me some optimism. The other source of optimism, I think, is that medical students are a bit more facile with electronics than older people are, so it may be a bit less distracting, and they also might be in a better position to do something about that particular kind of intrusion. I'm finding medical students to be more willing to express affect than they were like when I was a student 20 or 30 years ago, that kind of macho exterior. About 4 years ago, the entire entering surgical resident class at our institution were all women. And so that kind of social phenomenon, I mean, surgery used to be, and still is in some ways, kind of pretty macho. And and also the attendees at our workshops really span disciplines. We actually did 2 sets of workshops at a particular health center for their transplant team. So these are people, doing liver transplants, and they wanted their team to work more effectively together and also deal with tragedy and loss and errors, and which when in this kind of high-risk environment are more common. So I see these little islands. What I don't see is coalescence, and maybe that's too much to ask in the fragmented healthcare environment that we live with here. But I do see these islands, and I also see whole institutions whose CEO is really passionate about creating a more mindful organization, and that's pretty inspiring There are several that I've visited. So I do have some hope.
That's good. I have some hope too. No, I think, the piece about the islands of like reaching individuals or, the islands I feel that I'm able to reach on a daily basis or just individual people and individual residents and individual students and individual patients and kind of reminding them to literally take a breath before they run and tell me the story, or just kind of giving little pieces. And I'm hoping that that's going to kind of spread around and spread the word. But I do think that, and obviously this is because I'm a pediatrician, probably, that I think that getting this kind of, this practice, this kind of information, and basically this life-changing journey to kids is really most important. And so I really try to teach this to my patients and parents, and I hoping that this moves out to schools, not just medical school, but the elementary school, the middle schools, and things like that. I think that's paramount.
My daughter's a second-year medical student, and in her first week of her first year, they spent an entire afternoon on mindfulness. Now, I thought, well, it's 3 hours. Okay, what can you do in 3 hours? But on the other hand, this sends a powerful message. This is important enough to put right up front, and that's not the only one. So a question comes up. Do you really want to? What's realistic? Is everyone going to start a meditation practice and meditate for an hour every day? No. But these little things, anyone can stop for a second when they touch a door handle. That's really easy. Okay. And we've got a dozen other things that we can suggest about ways of bringing mindfulness into the workday. And medical students say, oh yeah, I can do that. And if they know that their colleagues are doing it and it's not seen as something weird, then the accumulation of all those small actions may actually add up to something.
My name's Charles. Wow. Okay. Sorry. My name's Charles Riffey. I'm a chaplain resident, and I very much enjoyed what you had brought up in many respects. I heard awareness and pragmatism, which I think is helpful in all that we do in our different facets. I was also intrigued by slides that you brought about when you discussed meaning and also discussed curiosity, that slide with the little child. I always wish to be more pragmatic in my approaches, but I've often felt personally that the desire to be more pragmatic is not reason enough to continue seeking or a practice of something in mindfulness. My question to you would be, outside of pragmatism, personally, what has been a fostering force to use mindfulness to help sort of identify your sense of being as a human, as a practitioner?
Yeah, that's my next book. Seriously, because I think that really it involves that intention piece of just trying to identify those things that are really most important in one's life and that give you a sense of coherence. And I mean, you as a chaplain, I'm sure fully understand that. If you read medical students' application essays for medical school, they are often quite inspiring and quite wise and deep, even though these are young people. And then something happens. And so I see it as my mission, partially just to remind students of who they are. All this, I'm a great fan of Walt Whitman, and one of the great lines from there is, do I contradict myself? Yes, I contradict myself. I contain multitudes. And the multitudes part, I think, is really, really important, because if you're monochromatic, if you only have one song to sing, if you only have one way of relating to the world, your life is going to be pretty impoverished. And I think it's a setup for disillusionment. And so developing a degree of suppleness and of flexibility while also knowing what the most important things are in your life, I think is something that for me has been incredibly important, whether I'm playing music or sitting on a cushion or across the table from a patient. So that's the beginning of an answer, but we'll have a beer sometime. Okay.
My name is Kaywood Fitzhugh. I work for the Department of Family Medicine as a nurse practitioner. I've been involved in the mindfulness community here at UVA for probably about 9 years. So I have 2 parts to my question. The first is to thank you for coming up from Rochester to be with us. It's been really wonderful to read a lot of your work and research and to hear Mick, who came about a year or 2 years ago. So it's delightful to meet you. My question is that we have a lot of pockets of very wonderful offerings in mindfulness and yoga here at UVA. It seems that I'd like to know, do you have ways in which we can work collectively so that it can reach more of the university, is the first question. And then the second question is, do you see ways that universities can work in collaboration in terms of research for mindfulness or yoga, and how we could enhance that more between, the universities like UVA in Rochester or other universities in the country?
In terms of your local landscape, the meeting that I had this morning with various people from different departments coalesced because there was a visiting professor coming from somewhere else. So I suggested that they invite a fictitious visiting professor frequently. It's a lot cheaper, you can just get together, but often we need an excuse to come together. And I'm just making a joke, but that commonality exists. It's just a question of creating the space and the will. In terms of collaborating across institutions, I see that as a pragmatic issue as opposed to a philosophical one. That research costs money, and so someone's got to write the grant. And when the grant happens, then you can do it. I don't see really any philosophical barrier. I'd love to work with you guys. So.
Thank you.
And I think we have come to the end of our time, but your question perhaps would be a good one, again, for committees to think about, groups to think about, and then a presentation at another medical center hour in another year to see what kind of progress we might have made. I'm sorry that this hour has come to an end. I hope it's been fruitful for all of you here. We also hope you'll join us next week for the Hayden Farr Lecture in Virology and Epidemiology, also a Medicine Grand Rounds. We have Michael Osterholm here with us from the University of Minnesota in a talk on Deadliest Enemy, Our War Against Killer Germs. He's actually one of the world's authorities on pandemic preparedness. So in this beginning of the flu season, good program to come to. So we'll see you then. Again, please join me in thanking Ron Epstein, Ina Stevens.
Absolutely.
Thank you so much. So rush up there. Okay. Excellent. Well, he actually needs to go up.